I wanted to say something real quick that I won't take up a whole lot of time, but I like to think of myself as a student of history. And there doesn't a day or a week go by where I'm not researching some particular thing that happened in American or world history. I was looking up and researching Eleanor Roosevelt just a couple of days ago, and I learned some things about her and FDR that may not be that great to share, but history is very important to me, and one of the things that I always think about is, wow, wouldn't it have been great to have been part of things like the generation that defeated the Nazis and brought us out of the Great Depression? Or wouldn't it have been great to be part of the Civil Rights Movement? There are probably a couple of people in this room who were part of the Civil Rights Movement in the 1960s. Wouldn't it be great if I could do something like that? And you know what I realized? In the last 16 months, we've elected the first African-American president, and we passed healthcare reform. We're part of something like that going on right now. I was just thinking about that in the last 24 to 48 hours. And I thought, wow, 20 years from now, 30 years from now, 40 years from now, people are going to be thinking about, wasn't it amazing? Wouldn't it have been great to be a part of that generation that did that? So I just thought I'd share that with you all before we get started. Since the healthcare reform bill has been in its earliest stages, almost 11 months ago, it's been that long. We've been fighting this thing that long. It feels longer, actually. I have been working, as Chet mentioned, to understand what's going on, both in terms of what's in the bill and the political forces around it. When the healthcare reform bill was finally passed, it's gone through all these iterations, all these changes, I went through it to try to find out what is exactly in here and how does it affect everyone, people of different economic backgrounds, people of different family sizes. And I spent really a lot of time in the last 7 to 9 days to try to understand it well enough to speak to groups like this one. So without further ado, what I'm going to talk to you guys here about today is, first of all, what provisions go into effect this year. Okay. Then, what provisions go into effect over time between now and like 2014. And then I'm actually going to take us through various case studies. So if you're a family with this size and this income, or if you're a single person or whatever, this is how the healthcare reform bill is going to affect you. Then I'm going to talk about impact on employers, because I think that's very important. And then we're going to go into how is it funded. If we still have time, I'm going to talk about some of my favorite topics, which are the political ramifications of the healthcare reform bill.
Steve, what you're going to talk about how it applies specifically to Harlem as well within each of these contexts?
Well, I'll tell you about that.
You can all add on. Okay, got it.
We can add on to that. But the very first case study that I do is regarding a family of 4 with an income of $42,000 a year that does not have health care through their employment. The reason why I chose $42,000 is I actually went through the demographics of Harlem, and I took the average between the mean and median income in Harlem. Okay, so that's why I settled on that particular number. Go ahead, Chet. So what goes into effect this year? Well, first of all, we have expanded coverage for dependents to age 26. Right now, if you have children around age 21 or 22, depending upon if they're still in school. If they're not in school, they lose it earlier. But at around age 21 or 22, they will lose the ability to be covered under it. And so what you have right now, one of the largest group of uninsured people is young adults. So right off the bat, by allowing parents to keep children young adults up until age 26, I guess that shows you I'm starting to get old. But if it allows you to keep young adults up to age 26 on their health insurance plan, that takes a wide group of the uninsured and brings them into having some sort of health insurance. So that doesn't sound important when you first think about it, but it is actually very important. Effect number 2, senior citizens. Sorry.
Question about that. I was talking to a young lady. She's in her early 20s. She has not been on her family's insurance. She's wondering, can she get on at this point and stay on until she's 26?
September.
She can.
Starting in September.
I didn't know what to tell her. Thank you.
Senior citizens, screening for certain types of illnesses, including cancer, will be provided with no co-payments, or deductibles, free at no charge. This will also apply to everyone else enrolling in a new plan. If you're in an existing plan, that doesn't take into effect right away, but if you're a senior, it does, and if you're buying a new health insurance plan, it takes into effect right away. It's not just cancer. What they're doing here is any type of illness that they determine that early screening will both give you a much better prognosis and will save money. They're going to take all the cost out of it for people. They want people to get early screening for those types of diseases. It makes a lot of sense. People are wondering where the savings is going to come from in healthcare reform. This is one of the ways that it's going to come. It costs a lot more to deal with cancer in stage 4 or stage 5 than it does in stage 1. Number 3, a temporary national high-risk pool will be created to provide health coverage to individuals with pre-existing medical conditions. You've heard a lot about pre-existing conditions. There's really 2 tiers of ways that they're addressing the pre-existing condition issue. The first one is this. If you have been without health care coverage for at least 6 months, and you cannot get health care coverage because of a pre-existing condition, they're creating this pool where you'll be able to get it. That's the first way they're addressing this. There's another way, and I'll talk about that later when we get into things that are going into effect a little later on. Number 4, requires coverage without co-payment or cost sharing or recommended immunization, preventative care for infants, children, and adolescents, and additional preventive care and screenings for women. Very similar to the idea that I talked about earlier with senior citizens. Okay. Children, adolescents, and women in certain situations, that is going to go into effect right away. Okay. Again, same principle. Saves money, keeps people healthier. It's really smart. And I think it's appropriate for me to say at this point. There's more to talk about what goes into effect right away. The more I research this bill, the more I like it. There's been a lot of terrible stuff said about this bill from a lot of different corners of the political spectrum. But I think that you'll agree with me once we go through this. This is a pretty darn good bill. Certainly great for a start.
Right.
This is definitely something we can do. You go on to the next page. Sorry. Effect number 5. Provide tax credits to small employers with no more than 25 employees and average annual wages of less than $50,000 that provide health insurance for employees. We'll talk about this more later on. But one of the things the Republicans are going to say is, oh, this new health care reform bill is going to, it's going to hurt small businesses, it's going to hurt large businesses, it's going to cause unemployment. It's not going to do that. As you'll see, it's actually going to strengthen small businesses. If you can come in with tax credits, allow small businesses to cheaply insure people, that's going to help those businesses. It's going to help them be more productive. If those people get sick that work for those companies, that's productivity lost to those businesses. Again, those people are going to stay healthy. They're going to get the preventative care that they need. That's going to make American business stronger. Got a question? Go ahead.
Does that apply for sole proprietorship or not?
Yes. Again, it depends on income level. It depends on a couple of things, but yes. Number 6, bans insurance companies from dropping coverage because you get sick. Huge, right? Huge. I don't think there's anybody in this room who doesn't know of a situation where a friend or family member is paying their premiums dutifully all along. All of a sudden they get sick, and the next month their health insurance drops. That's, I don't know how we allow that to go on for so long, but it's over. Number 7, prohibits denying coverage to children with pre-existing conditions. So for everyone, they get a coverage through a pool, but for children, starting right away on all health insurance plans, you cannot deny coverage to children for pre-existing conditions.